Hello and welcome. Welcome to my channel Osce with Bimal. Today I am going to talk to you about UK Nmc Osce examination. UK Nmc Osce examination is a practice training in which you will be given different scenarios and you have to tackle that scenario over there. So I am going to give you a basic understanding of UK Nmc Osce examination and what all things the examiner is going to expect from that side. If anybody is looking for Osce training online or offline, come back to me. I'm ready to help you. Okay, I'm a person who is having a 17 years experience in the UK area system as a nurse and nurse manager in hospital and as well as in nursing home. And also I'm conducting Osce training for last 2 years with 100% success. Myself is very few trainers in South India doing the UK Nmc Osce training. I'm going to start a series of sessions on Osce on the side, and this video is exclusively for those who are outside Kerala, non-Keralites as well as outside India. So I'm going to run down the whole scenario of Osce over there, and we will see how the Osce is going to happen. So Osce is basically a practice examination, I told you, and this is going to be conducted around in 5 centers in UK. So Osce is considered as a part of test of competence examination. That's the second part of second test of competence examination. If anybody who trained outside UK needs to have to go for CBT and Osce in order to get pass over there. If you are asking me how is the Osce okay, Osce is hard enough or not, it's not hard enough, but you need some training because our practice of examination or our practice of approaching the patient is quite different from their side. So I will run down the scenarios one by one, and we will discuss about all these things. So the other side is the stations. Osce consists of 10 stations. The 4 stations are called APIE stations. That's not coming up in a series. Sometimes you will be getting the other stations as first. So APIE station, and then there is a 4 skill stations, and there is a professional value station, and there is an evidence-based station. So these are the stations you are going to get. And APIE means assessment, planning, implementation, evaluation. So you will have to do a comprehensive holistic assessment for a patient, and then you have to that's the first station there. And thereafter, once you finish that station, you have to come out and you have to go for a care plan writing. That's called a planning station. That's a silent station in which there is no patient or mannequin will be there. And the third part will be the implementation station. You have to give an oral medication for the patient. So that's the third part. And the fourth part will be you have to go for an evaluation in which you have to transfer the patient. So it's like a storyboard. The whole scenario will be working as the storyboard. One patient is coming to the emergency department, and then you are going to assess the patient, write a care plan for the patient, do an implementation for the patient, and you have to evaluate and transfer the patient. So this is what is called APIE. So APIE is going to happen in the hospital scenario as well as in the community scenario. There are different diagnosis patients will be coming up over there. So for example, patients who are having head injury, or patient is having asthma, patient is who are having homeless, patient who are having sleeplessness and the stuff like that. So there are so many scenarios. I'm not exactly remembering the whole scenarios, but so many scenarios will come up in front of you. But what you are going to do in the hospital scenario is you are going to do a vital sign assessment and a new start escalation. So A to E assessment is the part of the airway, breathing, circulation, disability and exposure you are going to assess, and meanwhile you are doing the vital signs, and thereafter you are going to escalate to the plan. So that's what is going to happen in case of assessment station, okay, in the hospital scenario. And on top of that, if the patient is having head injury, now your job is you have to do a neurovascular assessment, neurological assessment as well, just called GC score assessment. So that also you have to do, okay. But in case of community scenario, the patient will be usually in the home or a nursing home, where your job is you have to take a vital signs and escalate the plan. And also on top of that, you have to do a must score assessment. That means the patient is having weight loss, or patient is having nutritional problems, or otherwise you will be getting a patient who is having depression, and you have to do a PHQ-9 assessment in which you have to see whether the patient is having a high risk for suicide because the patient is having depression over there. So this is the scenario that's going to happen over there in the community. Then you will go for the planning station. You have to write a care plan over there, but pretty same in the community as well as in the hospital scenario. And the other one is the implementation, pretty same, and the evaluation is pretty same. It's like a storyboard. It's working over there. The other side of the story is there is an Alzheimer's or a dementia station will be there. So in dementia station, what's going to happen is you have to assess the patient memory with the help of a 6-CIT test. 6-sit test. Okay, so sometimes you will be asked do a 6-sit test, or sometimes there will be it's already preset, and you have to escalate the plan over there. And along with that, you have to do the vital signs as well. Usually this is coming as a community assessment station. So these are the stations you are going to get in the APIE. Okay, I told you about APIE is a hospital scenario and a community scenario will come up, and most of them are community and hospital scenario is pretty same. Community will go community wise and the hospital will go hospital wise, but the Alzheimer's is having a quite different way. Alzheimer's the assessment is different, planning is different, and implementation is different, and evaluation is different. Okay, so that's about the APIE station. Thereafter you have some 4 skill stations. So the Nmc has given a list of around 21 stations, in which you will be getting 4 in random. Sometimes you will be getting 4 skill stations in random, and then you got to go for APIE as well. So the example for these skill stations are, for example, respiratory interventions like patients who are having the peep flow meter, then the inhaled medicine, then oxygen administration, then catheter removal, then midstream urine assessment, MSU collection. Likewise, 21 stations, injections are there. Likewise, 21 stations are there. So there is a scenario will be given for you, and in which you have to go inside the station and finish the procedure and come back. Okay, so that's about the skill station. And thereafter you have there is another 2 stations left over, that's called a professional value station. In professional value station, what's going to happen is your job is to look for professional how you are going to react with the professional ethical problem. Something like a nurse is going to do some medication error, and she's coming back to you and talk to you, I have done a medication error, so what's your response? Likewise, some ethical problems are based upon the UK NMC code of conduct will come up in front of you, and your job is you have to write down this one your points in 5 bullet points. There is no patient over there, and it's a silent station. Like the evidence-based station is they want to check whether the nurse is having any research background over there. So they have a problem, something like a hypothesis will come up in front of you, and then small abstracts will come up in front of you, and you have to, based upon the abstract, you have to make your own points over there. So 5 points. So these are the stations you are going to get in the OSCE examination. So once you are going to get the OSCE examination, the pass percentage, they are going to expect some around 70% for performance as pass percentage. But there are red flags will be there. Red flags means these are the certain critical elements based upon patient safety, and if you are going to violate this element, you are going to fail over there. Myself is doing OSCE for nearly 2 years with 100% success rate. If anybody is looking for OSCE training online or offline, come back to me. I have experience in UK IRID system for nearly 17 years. I was a manager over there. I was a nurse over there in a 4-stage referral hospital, along with hematology, oncology, bone marrow transplant, and also I was a manager in a nursing home over there. I was a nurse and a nurse manager over there. So I worked with all these policies. I worked with all these the white boys and girls over there. We know the task over there. I was a preceptor over there. I was a mentor over there. I was a part of infection control team. I was a part of disciplinary committee. I was a part of international recruitment board. I was a part of a COVID control team. So myself chaired some of the committees. So I have extensive experience on this side. If anybody is looking for OSCE training, come back to me. I hope you have got a basic idea about OSCE examination, UK OSCE examination. I am going to start a series of sessions on OSCE examination. This video is exclusively for non-Keralites, and the Keralites also find it useful, because I am getting a lot of requests from outside Keralites. So they are looking for training or the videos on English so that they can assimilate their part over there. So thank you very much for listening to my wonderful video. If you are happy with my video, please subscribe my video and give a like, and also share this video to your friends and circles, so that they can have some information on the UK OSCE examination. Thank you very much for listening to this video one more time, and I will come back with another wonderful video in the next session.